cysts on your ovaries mean that you have PCOS? Short answer is no. If you have cysts on your ovaries, this doesn't necessarily mean that you have polycystic ovarian syndrome. If you have cysts, doesn't necessarily mean PCOS, and you can actually have PCOS without having cysts on your ovaries. Polycystic in polycystic ovarian syndrome refers to multiple fluid-filled follicles. They're actually immature follicles and not true cysts. Rather, they are underdeveloped follicles that did not mature during ovulation. To be diagnosed with PCOS, there are some other symptoms that would need to be taken into consideration by your doctor in order to make a diagnosis. So just because you had cysts on your ovaries doesn't necessarily mean that you have PCOS. Some cysts are functional cysts. And these cysts happen normally during your menstrual cycle, and they tend to fluctuate. So they may be there one day and then disappear the next. They usually happen as a result of the follicles maturing, and sometimes it happens after ovulation, which is known as a corpus luteal cyst. Endometriomas are another example of cysts on the ovaries. Endometriomas are associated with endometriosis, which is a condition where tissue similar to the lining of the uterus grows outside of the uterus. So with endometriomas, you have that lining or that tissue that's similar to the lining of the uterus, creating cysts on the ovaries. And then there are other types of cysts like dermoid cysts and cystadenomas. Cysts also commonly develop if you are on hormonal contraception. So if you've been on the birth control pill, for example, this is a very common cause of cysts on the ovaries. So I know this can be a little bit confusing. In reality, a lot of us have had cysts on our ovaries and probably will have cysts on our ovaries, and it doesn't necessarily mean anything in particular, but it is important that if you are concerned and if you have other symptoms associated with the finding of cysts on your ovaries, that you speak to your doctor about a potential diagnosis.